The Ghana Registered Nurses and Midwives Association, GRNMA, as part of its welfare packages for all nurses and midwives in Ghana, has established what has become known as the GRNMA Health Fund. The association initiated this fund purposely to help and give lifeline support to all members who fall ill in the course of duty or in dire need of health support. The association, under the leadership of Mrs. Perpetual Ofori-Ampofo and her team, continues to support thousands of health needs of members through this established fund.
These checks, as issued from the headquarters, they are monies meant to be given to members at the district level. So this short documentary will introduce us to how the monies have been very beneficial to the recipients. So it's something that we, as a region, central region, want to follow up on our members to see the life-changing acts that is helping so much, not only the nurses and midwives, but entire families who, at the time of some of the illnesses, do not have much to help these the members of the family. So follow us and let's go and see in the districts within central region how the health fund is supporting.
We have been in nursing for long. And we were saying that we don't know what the association has been doing for us. And we have paid dues all these years. I must say that we are so grateful to you for this health fund that was introduced, because it has brought relief to many people. And from our hospital, I can attest to 3 people who have directly benefited from this health fund. So I can say that one person who was suffering from cancer and was undergoing cancer treatment benefited for 50,000 Ghana cedis. One person had that, and one person
50,000 Ghana cedis.
50,000 Ghana cedis.
That's in the old Ghana cedis.
It will be 500 million.
Wow.
For it, and it's a great relief. Wow. Looking at the cost of cancer treatment, we are grateful to that. And then one nurse who couldn't purchase her medications for DVT too also benefited. 4,200 was given onto, and of lately one person who had hip replacement too has been offered or given, which I was present, and I even received a check for him.
Wow.
He had 20,000 Ghana cedis. I hope that you come to support him more, because his surgery was costly and 100,000. So I believe that when things are good, you will come and then top up for him. So the health fund is helping very much. Very grateful. Thank you so much.
So as our director is saying, liver twist still asks for more.
Yeah. The Central Regional Chairman, Mr. Alfred Addy, and his team through the GRNMA Media Central Region followed up on members who have been supported through the Health Fund.
We're informed that you had a little condition. How true is it?
Yeah, it's true. I was diagnosed kidney failure.
So when you started the dialysis, how was it?
In fact, when I entered, seeing those people on the machine, and I'm like, is this what
You're going to go through?
Yes. Being on the machine itself, Nakasan, the stress you go through, the rigor, always vomiting. You can take like more for like 4,
But still,
so you feel this headache. And then it's like always you have to take injections because your blood will be going down.
yeah.
Onu so kakra. No tete. Mobo woda ma. Na doctor ni si amfani mreshi. Na 2 weeks bia wakada ma shi tu. Oye 3 mpo. Na
2 weeks be a
1 week bia wakada
machine.
Oye 3.
3 times.
3 times. But in sikano.
In a whole week.
Week.
Wow.
Tina sikano oye 0.2.
Now woko kubia waja.
Na yoko kubia 260.
260 Ghana cedis.
And some also a dra obawo. And some of the word move machine mobile manin birum wires. And some be pindu. No ya na wires na no boja ko form. Nti eji oji boja na ade.
Okay.
Nti edu be share na tell 2 week bia yoko hospital 2.
But as usual, with any functioning system, impact assessment is key to improving the desired fund outcomes. It is against this background that the Central Region, as part of its impact assessment strategy within the region, decided to visit beneficiaries of the health fund to ascertain the impact of health support.
So how did the GRNMA came in?
A friend of mine told me, a colleague of mine,
Okay.
yes, said if I contact them to,
They will assist you.
yes. So I told I think the organizer in our unit.
Okay.
So he took care of it.
Assistance from the association came. Was it timely? Has it helped?
Yes, a whole lot. Even though it didn't come early.
It didn't come early.
Yeah, but
I would say that it didn't apply early.
yeah, I didn't apply early.
So it didn't come early.
Yes.
That was not the fault of the association, I guess.
No.
Very good.
Yes. It came at the time that I was like in the point of need because that time Kolebu has gone for strike, like they were not working. And so when it came, I was really stressed, and it was like there were nowhere to turn to.
Okay.
So when it came, I was really, really happy and amazed. So when it came, I was supposed to do a new fistula.
Okay, you were to do a new one.
Yes.
Okay.
And because of the money, I was still using the old one. Meanwhile, I was not supposed to.
Because of the cost
Because
involved.
of the cost.
Okay.
So when it came up, I've been able to go and do it.
Okay. So how much came from the association to you?
80,000 Ghana cedis.
I didn't hear you.
80,000 Ghana cedis.
80,000 Ghana cedis
Yes.
from the association to only you.
Being on the machine is not easy. It's not easy. It's not easy. The stress, the trouble, the pains. Always, sometimes they have to carry you. Sometimes they have to use free chair and those things. Like it's not easy for me actually. So I think if I get a little push in transplant,
Kidney transplant,
I can be off
the dialysis.
And with that, I'll be able to work well. I want to thank them for their good work and their support, and I pray that they continue helping us.
I think I've heard about the fund, and I think the fund is really supporting the nurses, because I remember one of our nurses had an accident in one of the communities. If you've heard of that incident,
Yes.
at Taboso.
At Taboso, yes, please. Yeah.
In our own facility, I mean, he wasn't getting the support. Like, they were waiting for the family members. He was shouting, I'm a staff, but he wasn't getting the attention. But when GRNMA heard the news, I think they went in quickly to support him.
Yes.
And when the support went, I mean, he had the necessary attention from the service providers. So I think the health fund is really supporting the nurses. The directorate, you know, for example, where I work, regional head directorate, we don't generate. And we don't generate. So if you are a staff and you are sick, we all use NHIS. So we don't have any fund that supports staff when they are sick. So we all fall on NHIS when we are sick. So if the sickness is beyond what NHIS can support or can provide monies for, then you have to pay it yourself. The individual will have to bear the cost. The fund is supporting. And now I think what the fund does is that when the person is in a situation where the person cannot support him or herself, the person will have to inform the leadership.
Yes, please.
Yeah, then the leadership will come in to support.
Yes, please.
Can the leadership structure it in such that, like NHIS, when you are sick and you go to the facility, then they foot all the bill. We have to say thank you for the leadership of the association. We want you to keep it up because it's really helping the nurses.
Some months ago, the GRNMA, led by its executives for the central region and then also the district, Infantoman district, presented some amount for you, I think, as a result of an incident that happened during your work. We just wanted to find out from you, when this amount came, has it helped you in any way?
Oh, yeah. It has helped a lot, especially me. I've been a victim, and by the grace, because of this donation, it has helped me a lot. So I think the group is a nice group to be joined. All the health workers, I urge everyone to be part of it. It's really helping. It's really helping.
My district has benefited. Last year, a lady nurse working at a Rim Polyclinic called on the association in terms of her ill health. We were called to come for a check of 20,000 for that lady by name Josephine Young. And I think afterwards, she's had her life back.
Wow. It's the second time of our district receiving a benefit from the health fund. The first one was 60,000 Ghana cedis, and because of this, the money she received, she was able to go through her treatment very well, and now she has returned back to duty. And recently, one of our staff also was involved in RTA, and she had compound fracture. So you can see in my hand, I'm holding a check of 8,000 Ghana cedis. Also a benefit from the health fund. As a chairman, I received it on behalf of my member. I'm going to hand over this check to her. I know this check will go a long way to help her.
For 2021, I would want to start from 2021. We've had 360,000 Ghana cedis for the whole year of 2021. 2022, we have received from the national headquarters an amount of 420,000 Ghana cedis. And then this year, we have been able, as a region, to receive 320,000 Ghana cedis. These are applications that we receive from members who really need the help, and it's been great so far, and they have all received. Obviously, from the figures that I've given, it's clear that association is more than capable of helping its members when they are in need. The impacts that these donations that association is giving to sick members is being felt in the districts, and most members who are with them in the district, they are seeing it, and it's just a good time to be with the GRNMA because you do not know tomorrow. This is a time to be part of the GRNMA because the districts are feeling the impact of the health fund from the Ghana Registered Nurses and Midwives Association. So be part of the family. Thank you.
Of relations are chilling, and leadership must be proud of the creation and sustenance of this welfare package for nurses and midwives in Ghana.